My name is Petra, and I've been an amputee for 38 years, 36 of which I've had a socket. And recently, the last 17 months ago, I had osseointegration, and it has been life-changing.
Hi.
Hi.
How you feeling?
I feel great.
So it's been 17 months since we did the surgery.
Yes, and it's been life-changing. So when I came in here to have the consultation for the osseointegration, I felt like I was slowing down because I had the socket. So
How many years had you been in the socket?
36 years. And I had known about osseointegration, but the word on the street was, if you're doing okay in the socket, don't get the osseo. Why risk the surgery, the infection, or complications? But I felt like I was starting to slow down, and I didn't want to do that. And I felt this was really the best option for me to move forward, So I decided to go ahead and do it. And I feel like I've been doing such amazing things walking now and bike riding. Haven't done my whitewater rafting yet, but that will come.
That's awesome. Yeah, I heard we were talking before, and you were mentioning to me that sometimes some of your friends are having a hard time keeping up with you.
Yes, I know. I'm the one that's good now in the group. They don't have to worry about me. They used to I used to lag behind some, but now I'm the leader of the pack.
That's amazing. Well, I'm not surprised because you are an Olympic athlete also. So you're
Paralympic athlete.
Well,
yes.
Yeah. So you're an athlete by nature, and this in a certain respect is like an upgrade. It's a wheel change with an upgrade.
Yes. Oh my God, more than that, I think. Yeah. My fitness app tells me I'm doing more already this year than last year.
That's amazing.
My concern was I didn't know if my bone was going to be able to handle the osseointegration because I had osteopenia, and I didn't know if it would be able to take. So Dr. Rozbruch told me I was definitely a candidate, and from there we moved on. I had the surgery, and it really has been life-changing.
And it looks amazing. The bone, you can see the relationship between the implant and the bone is amazing. The bone has grown into all the nooks and crannies. Osseointegration means osseo means the bone integrates into the metal, and that's exactly what it's done here. This is a full integration of the bone into the titanium, the porous coated titanium implant. This looks amazing. This is solid, stable. You can do anything.
Great, because sometimes when I kneel hard, I get a little worried. But it's okay.
Yeah, no, this is very, very strong. You can actually see that the bone is actually getting stronger. You can see these little stress lines of where the bone is actually beefing up, because now, in contrast to before, you're actually putting stress and weight through the bone. So the osteopenia and osteoporosis concerns that happen for people, for everybody, but especially for amputees, really are taken care of with this procedure as well. So the x-rays look amazing.
Great.
Amazing.
Thinking about having osseointegration, and I have to say I am a nurse, an orthopedic nurse, and just knowing about surgery and the possibility for infection was a concern, or having maybe revision surgery, because I work with total joint replacement patients, so that's only my own personal concern. But what I would tell people with the osseointegration, it's just better. If you do the cleansing of the area, I have so far, thankfully, have not had any kinds of infection or any issues whatsoever, and my life has improved. My mobility has improved. I would certainly recommend it to anybody that asked about osseointegration.
So the aperture site looks great, looks very healthy. There's no sign of infection or anything like that. The skin has really grown really, really nicely around the implant. It looks great, looks strong. Let's see, let's bend your hip, lie down for me first. And let's bend your hip up and straighten it out. Stand up again and straighten it out. Love it. Looks amazing.
Dr. Rozbruch, I don't even know where to start. When I first met him, he came off so confident and reassuring, and he looked at me, I felt, and he knew that I was an amputee for so long and what my concerns were. He addressed those, and he said he was going to take care of me, and he did. His team has been fantastic. The whole office is friendly. When I reach out, email, I get very prompt responses. So I highly recommend the team at HSS.
So you can feel comfortable doing whatever is comfortable for you in terms of your mobility. You can walk as much as you like, listen to your body. If it feels good to walk a lot, walk a lot. Just, it'll keep getting stronger. In terms of the aperture, continue cleaning it just the way that you've been doing it. Daily shower is great, just soap and water, nothing fancy. You are free to cover it or to keep it open to the air. People are a little different with that. Some people like doing one, some people like doing the other. I'm good with whatever. I think some of the important principles, as you've heard me say before, just good hygiene, keep it clean, don't put your fingers into the aperture to avoid infections. A daily shower, washing it with soap and water is great. It's no problem to get into a chlorinated pool and do your thing.
I have done that.
Good. And yeah, sky's the limit. You can walk as much as you like. I mean, listen, we have people that are pushing the limits and walking a lot. I've even got some patients that are starting to run and do stuff like that. I'm not, do what feels right for you. The speed of your walk, the quality of your walk has improved.
Oh, yeah.
And clearly your endurance has improved.
Yeah, for sure.
You're able to walk longer, faster. The reason that the endurance improves is because you're so much more efficient. You're so much more efficient now. Mm-hmm. Like you're generating all this work and force with your hip muscles and your core, and it's actually being transmitted to your leg. So you're able to do more. You're just efficient.
My neighbors tell me when they see me walking the dog, like when I wear long pants, they said if they didn't know any better now, they wouldn't know that I had an amputation. So
that's amazing. And that's actually quite amazing for a transfemoral amputee to be told that, because that is a rarity.
Yeah.
Transtibial amputees sometimes can do that, but it's pretty rare that a transfemoral amputee can have a gait that looks so good that somebody would tell them that I didn't even know you were an amputee.
Yeah. For my future, I just want to keep moving because it's all about moving. I want to do more. I want to travel more. I have been to all 7 continents, and I'd like to keep doing all that. With osseointegration, I believe that I can do better at all my travels. I mean, I used to go, and I've been to these places, but of course there were several excursions, so to speak, that I couldn't do because of the length or the duration, because I would fear that I would be lagging behind. But now I don't see that anymore, so I know that I'll be able to do all the excursions that I want to, and I'm looking forward to that.